Are you framing yourself to sell? That's the question today on Doc Dynasty. I'm Dr. Raval, 36 years in private practice, and here to teach you the business of medicine and be completely committed to your autonomy. So everything in medicine is a sales pitch. Most of us as physicians don't like to think of ourselves this way, but that is exactly what we're doing. In other words, whatever specialty we have picked for ourselves, we want people to come in and see us instead of the person down the street or the person in the next town or the person that belongs to the other hospital. In order to get that, you need to frame yourself to be better than anyone else, and you need to do that from the eyes of a patient. So let's talk about that. Let's take an example of what any business is selling. So if you were selling a gym, every gym or fitness center has basically the same things. It has classes, it has some level of equipment, perhaps it has a pool, but what are they selling? They're not selling just those things, because otherwise you could go to any gym that has those things. What they're selling is confidence. They're selling you, we can help you with your body image. We can help you look better. That's what they're selling. The sales pitch is aimed at those items, not just what the gym looks like. So in the same way as you as a physician, I'm a podiatric surgeon, I want someone to come to me. So in the past, I've always had one of these signs. It says, we treat this and we do this and we give house calls and we do treat all these age groups. What we do now is say, hey, we solve ankle sprains in 5 steps. So not we treat, we solve. Not we treat pain in your bunion, in your hammer toes, in your arch, but we solve that or we end that pain. So every item that we put out there is about solving, about ending, is about treatment to make you feel better. So every pitch is about the end result. And what patients are looking at is the end result. So when they come to you because they've tried 2 other people that didn't solve their problem, they're looking for you to solve a problem. So you need to pitch that problem. You need to frame that in a way that sells it to the patient as your end result. This being said, so let me just give you some examples that we use. We use conquer. We use solve. When we see different age groups, we say, we end falling in 65 and over patients. We stop flat feet from causing pain. We stop chronic ankle instability in 5 steps. We end tripping in infants or in toddlers. We are the one-stop shop for custom orthotics. So there's an end. This is where you want to be for these items. It is based on the result and not what you treat. That's the easiest way to put it. So you want to lead with the result. You want to lead with a transformative action. You want to back it up with details. So don't put anything on there that you don't actually treat or you don't actually feel you can solve. If you need to build that confidence, build the confidence while you're working for someone else or in your residency or fellowship. But when you put something out there that says, I'm going to solve it, you better be able to solve it. So transformative, you back it up with details and you speak a patient's language. So walk to the outside of your building and say, does this building look like something that I can treat a patient with to the point where I can solve that problem? When you put ads out there or you put things on your billboard, it should be, how are you going to end it? How are you going to stop it? How are you going to conquer it? What are you actually doing for that patient? Hope this is helpful. Frame what you do as a sales pitch. Very hard thing to do as a doctor because we've always done the opposite. We've just built resumes and treated. But if you're going to succeed as a doctor, you need to be able to sell yourself to a patient from a patient's point of view. Hope this is helpful.